discover how aspirin worked until the late 1970s. In spite of being able to isolate the drug, they did not discover how the mechanism of action until the late 1970s. Unlike narcotics, the morphine and the codeine. Aspirin drugs are real workhorses. We call them workhorses that actually go to the source of the pain and stop it.
Find it.
So they find, unlike the morphine, the codeine, which are the opioids, they don't kill it, they just change your perception of it. The aspirin will find the pain and stop it.
The source of the pain and stop it.
That's right.
Attack the pain.
That's right. So when the cells are damaged, like when you get a cut or something, they produce large quantities of a certain enzyme. I might call a name for you if it make a difference.
Sense.
I don't know if it makes a difference, but cyclooxygenase 2, we call it. So this is an enzyme found in the body. So when you get, for example, a cut, the enzyme in turn produces, once it's released in the body, it produces chemicals, another set of chemicals we call prostaglandins. Those chemicals are like, they produce for almost everything, every illness, everything in the body. But we have that
to
enzyme.
To fight against.
For different reasons. They have different indications and functions, yes. So the enzyme will produce that chemical. Once that chemical is produced, it will send a signal to the brain. And that also causes the area that has been damaged, the cut, where you get the cut, to release the fluid from the blood to create a cushion so that the damaged cell doesn't take any more of the beating. You understand? So this is what happens. So you have the enzyme that is released, will produce the prostaglandins, and then the prostaglandins will, fluids, once they're released in the blood, they will almost form a cushion so that the cells will not be further damaged. And they don't take any more blows, beating, we call, in inverted commas. This cushion is what we call swelling and inflammation. This is the medical definition. People say, but I have inflammation, but we have a different description for it in medicine. So the cushion I spoke of to prevent the damage is what we call swelling and inflammation, and it goes along with our aches and pains. So you'll see redness, a little soreness, inflamed, shiny areas. This is what we call inflammation. So when we take the aspirin, what happens? It dissolves in our stomach and it travels through the whole body via the bloodstream. So it's going to be in the entire bloodstream, all over the body. But although it is everywhere, it only works at its magic site. And that is the site of the cell damage. By binding to that enzyme that I spoke of, chloroxygenase, and stopping them from producing the prostaglandin. Because the prostaglandins that these enzymes produce, this is what causes the aches and pain. So the aspirin will go straight to that site. So if it's to your finger, because the blood is flowing everywhere for your body, it's not specific to any one place. So once the aspirin is dissolved, when it gets to the fingertip, it's going to work there. So it finds that site and it kills the pain. So that is what they discovered in the late 1970s. It was happening all the time, but they had no idea exactly what was working. You understand? So this is an excellent drug. So because of that, no more prostaglandin would mean no more pain signals. Okay? And the cells at the damaged site are still damaged. The cells are still damaged, but we are left blissfully unaware of that because it kills the pain. That's the difference between the opioids and the aspirins.
And then we see, of course, medicine la fait moins bien, tablet la fait moins bien.
Yes. But before I stop there, I want to say that the prostaglandin power, stopping power, is also why people take aspirins on a regular basis to reduce what is known for taking aspirin, heart attacks. Because the prostaglandin in the bloodstream, it can cause clotting. And clotting is a process where you have a thickened mass in the blood that formed by platelets, which is another part of the formulation of the blood. Platelets now are tiny cells found within our blood. So the prostaglandin will cause that to cause a clot, and then stop the bleeding. Because the blood can no longer flow. You understand? So it stops the bleeding. And for just the same reason, the same example I used from a cut. But if that clot would break, right, and it flows through the bloodstream, it is something we call an embolus. It's like a ball. It comes together and it forms an embolus, and the condition is called embolism, where fragments is all over the blood and goes to different parts of the body. Additionally, the aspirin reduces the production of what we call thromboxane, which is the process of forming that clot, and it's a chemical that makes platelets. as I said earlier, the platelets are tiny fragments, and that is what comes together when we have the clot. So the aspirin will reduce that production, and the platelets now are less likely to form a clot and block our arteries. So that is the reason why you have the doctors recommending that, especially people that are prone to
every day.
People that are prone to heart attacks, strokes, whatever. You take a very small dose, very minute dose of aspirin once a day. The aspirin are still very effective for other pains, aches and pains, but it's going to be in a higher dosage from like 325 milligrams or 625 milligrams, but it's going to be for a period of time. But it's very still effective for other pains. People don't really use it that much. Everybody's taking the 81 milligram aspirin because they say it's to protect, but they don't use it primarily for headaches, fever, backaches, which is still very good because it's in a higher dosage form. The 81 milligram or 75 milligram, this is just to help prevent the possibility of heart attacks. And even recent studies have been showing that it's also good to protect against certain cancers. But the reason why it's not like widely used because of the irritation on the stomach lining, because it's acidic, it's an acid.
But is it children's aspirin that people can use? It's coated, right?
Well, you have the non-coated and the coated. If you have very sensitive stomach, then it will be recommended that you take something that's coated. If your stomach is less sensitive, you can take the chewables, which work very fast because they dissolve quickly in the saliva, or you can also take the dispersables, which dissolves in the water and you can drink it. So you have the chewables, the dispersables, and the coated, even if it's 81 or 625 or 650 milligram. It's just a different formulation of strength of the drug.
I think it's been a mouthful. I think we need a break now. Let's get a word from our sponsors. We'll be right back.
Comme madame a reporté ça que vous achetez médecine du côté Quick Care Pharmacy, where Harry do good boss Sinclair, if you want to support and learning. It is how cafe Episa, and not well my last few words. Episa. Harry upon yes, it's true. Pisa money on Tipotla. Dr. Dimop, who made the urine and Zemo 3 times a day. Madame Lieli, do urine, Harry, mew. No medicine boost, yep, are you? And where's the prescription? It is me a posh mommy. What's the sense of buying that? No, you see the importance of going to your pharmacist, listening to your pharmacist, and having confidence in your pharmacist. PS.Plus will they place a higher premium on patient-pharmacist relationship than Quick Care Pharmacy Kote Halsbro just before the National Bank. Kote Quick Care is not just a quick fix. It's not just about tablets and spoonfuls. They brought back the care into medicine. Whether it's a prescription or over-the-counter medication, the priority is your health. To take the right medication, the right amount for the right reason. Madam Harry, I see right in your medical book, Next of King, Henrietta Harry, movie farmer. By the way, it's Next of King, King. The Harry Ukakimo movie. All I want for you is good care. That is why I always recommend Quick Care Pharmacy. We go to Halsbro.
Okay, welcome back to Tablets and Spoonfuls on your radio. And of course, a little education today and what happens in the body when we take medication for pain. We just take it for granted sometimes, but we are learning how it works and the different types of pain medications. We spoke about the what's that?
Opioids. And the aspirin-like
drugs. Like codeine and, of course, morphine, a higher level of pain. And then the aspirin drugs like aspirin, of course.
We have the ibuprofen, we have the Aleve, we have the diclofenac. These are aspirin-like drugs because they are called non-steroidal anti-inflammatory drugs.
Okay. Mm-hmm. All right, we continue now. We're talking about pain and medication for pain.
Okay, so I'll just give you a few categories of the over-the-counter and some 1 or 2 prescription pain medication that you can use, but you still need to always speak with your pharmacist. We have the acetaminophen, which is commonly known as paracetamol. These are for mild analgesics, mild pain that do little to treat inflammation. It does not really treat inflammation, it's really mild, which is why it is not classified as a non-steroidal anti-inflammatory drug because it does nothing for inflammation, but they increase the body's pain threshold, right? So we have brand names like paracetamol, Panadol, we have Tylenol, we have Cetamol. These are common acetaminophen drugs. So if you have a mild headache, you can use it. Or the aches and pains, but not for toothache or those serious pains that we classified.
You hear people say sometimes, well, paracetamol, that can't do anything for me.
Well, that's why I said it is mainly for mild pain. You find paracetamol mainly, it is one of the most common pain reliever in cold and flu preparations because, again, it is for mild pain, mild aches.
And fever too. Does
It is also
helps
for
with
fever. It's also called an antipyretic. So,
right, because
so
you
it
take
helps.
paracetamol, it makes you sweat, and
Yes.
you know. But is
We
it
need to not take.
Yeah, question. Is it because people get accustomed to it that it loses its effect, or
No.
it's just a mild painkiller?
No, it's nothing to do.
For some people,
it is still
it works well for some people.
Well, it depends on what type of pain it is, and depends on the type of that. Yes, and
right.
it depends on the strength that you use. You have a maximum per day that you need to use, and you should not go beyond that. Because again, as we spoke of earlier in one of our programs, that paracetamol is metabolized in the liver, and we do not want to take paracetamol too often. We do not want to take it with alcohol. That is one of the drugs we say you have on the shelf in the bars and stuff, because if you think I have a headache, I can take paracetamol. Although it is relatively for mild pain, and there's the assumption that it is safe because it's over the counter, you still have to be very careful.
It can be dangerous.
It can also be dangerous because of
alcohol.
Yes, it can cause liver damage, especially when taken over several days in high doses. So you don't want to do that. We have another class of drugs that we call narcotic analgesics, and we just mentioned them. Those are the opioids that we spoke about, the morphine and the codeine. Then we have another category we call muscle relaxant. These are for pains as well, and these drugs sometimes they're called sedatives, simply because they make you
relax the body.
Yes, and you get drowsy, you get that sleepy feeling, and they reduce the pain by causing tense muscle groups, typically through a calming action. So it calms you down, and it works central nervous system. So
is diclofenac one of them?
No, it's not. I will give you an example. We have things like diazepam, Valium.
Valium, yes.
Yes, you would have. Yeah, you would have. Those are very common. They are mainly used for like spinal cord injury, the brain stem. They more relax you. They calm you. So
and
it's
as
not.
Said, they can be addictive too.
And they can be very addictive, because if you are in a lot of pains, and the drug, because of how it works, it creates that addicting effect, then if you're in a lot of pains, you're going to want to feel different. So you're going to want to use more and more. But then what happens is you also develop something called tolerance to the drug, and tolerance in medicine is different to the basic definition of tolerance, because it means that if you use 5 milligrams, and 5 milligrams in the beginning would give you a great relief from the medication, if over a period of time that you take the 5 milligrams, it's not going to be effective anymore. So you may have to use 4 times, which is not an appropriate dose, which is a fatal dose. You understand? So that is one of the problems with the addiction. And then because of time, we'll just look at another last analgesic. For pain, we have the topical ones. We have like creams, gels, the same drugs. They are available in that form.
In the form of a cream.
Right. So instead of taking it orally, if you have stomach issues or if you don't want to take medication orally, you can get the topical ones and apply directly to the site of the injury. So these are basically a few categories. We will talk about a few others in another program. But because of time, I hope that you were able to get some information from the categories that I mentioned.
Pain and pain killers and the effect on our body. That's what we looked at on today's program, Tablets and Spoonfuls. Got any questions, any comments, you can call. The number to call is
440-8600. And a final note is that it's important to mention that prescription painkillers are now the leading cause of accidental deaths. Yes, that's what they report in the U.S. Because you need to always speak with your pharmacist. Do not just take medication off the counter without asking a question. If you're going to use pain relief, please do so wisely and in consultation with your family doctor, your pharmacist, or your nurse. It's not something to scare you, but because people get so addictive, every time they have pain, they take this, they take that.
Compounded by taking alcohol and all of that too.
That is right.
You have accidents that occur to that.
That is right. So you just want to make sure that you speak with your pharmacist, you let them know what it is, what pain you're suffering from, and they can recommend something that is suitable based on what it is you're using in collaboration with that.
On this note, we'll end today's program, Tablets and Spoonful. We'll be back on your radio Lordsville next week, next Wednesday morning from 10 o'clock. Until that time, Mav Augustus.
Goodbye. I hope you had a really educative session today with us. I think I myself reminded myself of certain things as I spoke along.
I was just listening to you basically today and drinking all in.
Yes.
Yeah. Thank you. Till next time. Bye-bye.
Bye-bye.
Tablets and spoonfuls.